As most recent COVID-19 surge declines, masks, mandates and other precautions have started to lift across the world. But experts are cautioning that it is too soon to assume that the two-year pandemic is over. The World Health Organization's chief scientist, that's Dr. Soumya Swaminathan, joining us now from Geneva to talk us through whether or not COVID-19 is over. Dr. Swaminathan, thank you very much for your time. How should I phrase my question to you? Should it be that COVID-19 is over or the acute phase of COVID-19 is over?
Thank you very much, Hola, and pleasure to speak with you today. Yes, I think everyone wants it to be over. Aren't we all tired with the pandemic and all of the disruptions in the day-to-day life? It's impacted people all over the world. Now, what we have to understand is that this virus is so widely spread now amongst human beings and also among many animal species on this planet that it's unlikely that we're going to be able to eradicate or eliminate it. And so it is going to be with us for the foreseeable future. But what we have to try and do is to reduce the impact of this new virus on our lives, on our economy, on livelihoods, so that we can learn to live with the virus without it having this type of major disrupting influence on our lives. Now, we know a lot more about this virus now than we knew in 2020 when the pandemic began. And the best part is that we have tools. We know how to diagnose and detect. We have lots of diagnostic tests, including self-tests and rapid tests. We have vaccines, many vaccines that have been developed that are very safe and effective. And we have also now drugs, both to treat people, the immune system, to suppress it when people get really sick and they have an inflammatory response. I'm thinking about drugs like steroids, dexamethasone, as well as some of the immunomodulators. But also increasingly now, we're seeing the development of antivirals, of drugs that can be either given intravenously or orally, which will, reduce the viral multiplication. And so now we have. And then we also understand the public health measures that work. We understand that masks are very, very effective. We also know that ventilation is very important because when you have a closed space, then this virus is able to infect many more people if there's one person that's putting out a lot of virus. So governments are also in a better position now to deal with new variants, new outbreaks. We know what needs to be done. And I think it's important not to have an all or none phenomenon. We cannot, at this point in the pandemic, say that, okay, now, my country is out of it and I can go back to being normal the way it was before. The rest of the world may continue to struggle. That's not a good approach to dealing with a pandemic. And so we have to get to the point where people have enough immunity across the world, in every country, especially the vulnerable groups, so we can reduce mortality. And I was quite shocked to see the latest figures coming out of all the countries that report to WHO that deaths have significantly increased. We had seen 50,000 deaths a day happening from the last 6 months or so. It had been fairly stable at about that level, a little bit up and down. But the last week, we've seen average death rates across the world of 70,000 a day. So there's still far too many people dying from this. And that is what we call, when we say ending the acute phase of the pandemic, we have to bring down the mortality, which then results, of course, in impacts on the health system, overburdening, and then that spills over into all the other economic impacts.
Doctor, talk to us about the people who are seen as anti-vaxxers. In fact, as I speak to you, coincidentally, we're running with a breaking news strap about the world tennis number one, Novak Djokovic, who, and as it is captured on the screen, he says that he is willing to miss major tournaments if he is going to be forced to vaccinate. What would your message be to people who stand completely opposed to vaccinating?
I think I would like to understand why, and I think every individual may have a slightly different understanding. I think that a lot of people get influenced by peers, in their communities, local leaders. They could be religious and spiritual leaders, or they could be celebrities like you just mentioned, or there could be others in the community that are spreading information that people are hearing and are getting worried about. So the first thing I would like to do, and there is no generic solution for this. We need a very localized approach. In one particular community, if we see that there are a lot of people who seem to be not willing to take the vaccine, we need to go in there and understand why. What is it that they're hearing? And they have genuine questions and queries that sometimes when you answer, when I was in South Africa last week, I went to one of the vaccine taxi sites and I got to talk to a couple of people who'd come for their vaccination, older people who actually really didn't know how many doses they needed, why they needed a booster dose, after how long, and what is it going to do, and are they going to feel all right after the second dose? And some of them had seen things on WhatsApp that had worried them. And when someone took the time to explain to them, they were convinced, and then they signed up for either the first dose or the second dose of their vaccine. So in a lot of cases it's that, but unfortunately I have to say also very unfortunate that in many countries this has become an ideological thing. It really shouldn't be. It's scientific. Vaccines have saved lives. The biggest discoveries of the 20th century are vaccines, and we've seen what they've done to polio and smallpox and measles, and saved millions and millions of lives of mostly young children. But also tetanus. I've seen tetanus, killing people when I was training as a doctor. So all that's gone now because of vaccines. We need to remind people of the power of vaccines. And if they have specific questions, let's answer. And we have to try to keep ideology away.
Let me ask you this question, Doctor. While we're still on the subject of vaccines that you have now brought up, when people, ordinary people, let me put it that way, you mentioned earlier that sometimes you're dealing with celebrities. Novak Djokovic is no small-time celebrity. He is a world great tennis player. In South Africa, we have a former Chief Justice, most recently a Chief Justice, who still is very, very opposed to vaccinating. In fact, I think he was on television last night talking about how he simply does not trust the vaccines because he does not know what is inside these vaccines. So there are questions that are clearly directed at whether or not we should trust the efficacy of the vaccines. I'm going to lump two questions in one to you. Are you aware of scientists around the world who are of the view that many of the vaccines available right now are still at trial phase and therefore they should not be trusted? But you link to that question the other one that is linked to it, and that is that, are these vaccines safe to begin with?
Okay, these are good questions, and I think if people are asking these questions, that they also deserve answers. And yes, we can talk about how these vaccines have been developed. One of the questions that often comes up is, they were developed so quickly that were they really studied properly? Can we be sure that, their safety has been assured? And I can tell you that at the WHO, we have a very rigorous system when we look at vaccines or drugs for emergency use authorization. And of course, in a pandemic, you cannot wait 5 years to do the kind of trials that would normally be done in the usual timelines. So everything was compressed, but at the same time, things were done. No vaccines have been administered to people without having gone through all the phases of preclinical testing and then phase 1, 2, and 3 trials. And companies and countries made all sorts of, and regulatory agencies worked together to ensure the timelines could be shortened, but all the steps were followed. And WHO looks carefully at every dossier, at efficacy, of course, but also very much on safety. And even after the emergency use authorization, there is a period of time when companies have to report back any side effects that they're seeing. And as you know, with some of the vaccines, we've seen rare side effects, 1 in a million, 2 in a million people getting myocarditis with the mRNA vaccines, or the same proportion of people getting thrombotic. So nothing in life is 100% safe, and so it's always about the risk and the benefit. The risk of getting COVID and dying from it is many, many times higher than the risk of getting any kind of a side effect. Apart from local pain, and you might have body ache and fever for a day, those we consider mild side effects. But a serious side effect with these vaccines, and I think we've been lucky that the vaccines licensed so far have been so incredibly safe across age groups, across countries and continents. And we continue to monitor and inform the public about these rare events that are observed. And I think that type of transparent and open discussion with the public, especially with those who are questioning the validity of these vaccines and how they were developed. And now, that 10 billion doses have been administered globally. The largest vaccination program in history. And if there were serious problems with vaccines, we would have seen them. It couldn't have been hidden from the public. So I think it ought to give people confidence. Now that billions of people have received the vaccine, even if people didn't have confidence at the beginning, by now surely there is enough data out there, and the WHO continues to track. And at any time, if we think that the risks are going beyond the benefits, we will be the first ones to say that.
All right. Dr. Swaminathan, can I ask you for your indulgence? I need to take a break. If you still are available, I'd like to talk to you after the break about learning to live with this virus. What does that mean in terms of the non-pharmaceutical interventions? Lots of countries are doing away with lockdown restrictions. So what are the do's and don'ts? We continue after the break. You're watching Newsfeed AM, and if you're just joining us, we are talking to the World Health Organization's chief scientist, Dr. Soumya Swaminathan, and she's talking to us from Geneva, and we're talking COVID-19. Earlier, Doctor, we were talking about learning to live with this virus. I'm going to get to that in a moment, but something struck me as I pointed out to you last night when we talk about influential persons who are completely opposed to vaccines. That has a direct impact on whether or not ordinary folk are comfortable to taking these vaccines. In other words, are going to be willing to go and say, I want to be safe, or I still want to be around. I don't want to be taken by this virus, and therefore it's important for me to get vaccinated. One of the issues he raised was that he may possibly be aware of one of the senior executives in these pharmaceutical companies that have manufactured these vaccines, and that person would not take this vaccine if it was the last thing on earth. Are you aware of any CEO, perhaps, in any of these vaccine manufacturers who have manufactured these but are not willing to take it themselves?
I'm not aware of specific instances like this. I mean, there are a couple of cases, and I think they become very high profile because of their background. And it's unfortunate that even people who've been in high scientific positions and doctors, people coming from medical and science backgrounds, sometimes make these statements that actually don't have any substance to them or any proof. But the statements themselves are very damaging because of the reputation of these people, or the fact that they are scientists, they've been involved at some point in vaccine development. So I think it's very irresponsible of people in those positions, people who can have huge influence on others, making statements which clearly have no basis. And as I said earlier, 10 billion doses of these vaccines have been administered worldwide, at least a dozen different types of vaccines. The WHO has been monitoring it. Many of the countries' regulatory agencies are monitoring both effectiveness in real-world settings as well as safety in real-world administration. And Nothing like that. No such disastrous event has happened. So I think we have to take all of this with a pinch of salt. And on the one hand, we have reality. We have public health agencies. We have the WHO saying things. And on the other hand, you have once in a while somebody who's really making, very far-fetched statements which should be set aside.
Two quick questions as I let you go, Doctor. The first one, many countries worried about the state of their economies, and therefore lockdowns are going to be a thing of the past, but pharmaceutical interventions, or should I say non-pharmaceutical interventions, what can be done away with and what should be retained?
So this is a very good question, and again, there is no one-size-fits-all solution. Every country is in a slightly different situation. Why? Because the level of vaccination coverage in a country varies, and the number of vulnerable people, let's say people over 60 who've been vaccinated, varies, healthcare worker. So that's the first thing. How much vaccination coverage has the country achieved? The second is the age and demographic profile, and countries in Africa and some countries in South and Southeast Asia have a relatively younger population and therefore have had less deaths per million, than some of the high-income countries that have older populations. And then thirdly, the epidemiological situation in the country. How many waves of COVID have happened, and how have those been contained? And what is the current health system capacity and situation? Has that been enhanced? So based on all of these factors, we need to have a policy for each country, of course, based on the general principles that we now know that, as you mentioned, the non-pharmaceutical interventions basically are things which make people physically distance, things like hygiene, both cough hygiene and hand hygiene, wearing of well-fitting masks, ensuring that when you meet people, you're in a good, well-ventilated setting, avoiding particularly crowded indoor spaces. We know that these measures work to reduce transmission. And therefore, what we need now is a comprehensive, multi-layered approach, which, as I said earlier, is not an all or none, but really is graded and looking at the situation in the country. And this is where you need a very good and transparent communication between the public health agency, in the government, and people, explaining where we are in the pandemic and why we're dropping certain restrictions. And if at all some of those could come back, I agree that no country would ever go into the kind of lockdowns that we saw in 2020, which was so devastating for people. That shouldn't happen. And the way to avoid that is to keep a close eye on the epidemiology. And I think I would like to say that we need to be guided by the science. The virus continues to evolve. It continues to change. It will throw some surprises at us. We need to be prepared. We need our scientists, as they've been doing, to stay on top of it, to inform us about new variants or how they're behaving. Of course, we're also developing new tools, new vaccines and drugs are in the pipeline. They should be so the focus on research and development should continue, and we need to really focus this year on expanding vaccination coverage and getting to the 70% that the WHO has been talking about. That way, we build a wall of immunity against this virus, hopefully against future variants as well, and that's the way ultimately to be able to live with this virus.
Dr. Swaminathan, as you were speaking, you now have triggered yet another question. I promise, I'm wrapping it up. There's a question around the driver of new variants. And I can't miss this opportunity talking to the WHO to ask you the question very simply. What is the driver of new variants? Is it people who are unvaccinated?
The driver of new variants is basically the viral replication itself. So every time the virus divides and multiplies, it's an RNA virus, it's going to acquire some changes in its genome. Most of these are inconsequential. Some of these mutations give rise to properties which are advantageous for the virus in terms of how well it can spread or whether it can actually become resistant to the antibodies that we have due to vaccines and so on. So that's unpredictable. nobody can predict what the virus is going to do. What we can do is to try and reduce the chances for this virus to keep multiplying. And of course, wherever we find a lot of transmission happening in the community, the virus is going to change and evolve, and we can't stop that. So really the way, two-pronged. One, the vaccines protect people, protect us from getting sick. So for example, because we had so many people who had either prior infection or vaccination coverage, the Omicron wave was less devastating than, let's say, the Delta wave in most countries. However, you saw countries like the United States where you had high levels of hospitalization and deaths because they still had 40% of their population that had not been vaccinated and probably didn't have prior exposure to. So I think it's host immunity we need to build to be able to deal with the virus, and it should pass away as a respiratory infection. We shouldn't get sick from it or end up in the hospital. That's what vaccines are doing right now, and it's really good that they continue to work against all the known variants so far. And we're developing better vaccines to prevent infection as well. Ultimately, the goal will be a vaccine that not only prevents disease, but completely blocks infection. But we don't have those perfect vaccines yet, so we have to continue to develop them. But in the meantime, we need to use these non-pharmaceutical intervention measures to make sure that the virus has less chances of spreading from person to person, and in that process, evolving into new variants.
Final question. Vaccine availability has been a highly politicized affair. Where are we in terms of countries that have the know-how in manufacturing the vaccines, in sharing that information so that poorer countries or developing countries can start making this themselves so that the vaccines are readily available?
So this is what the WHO has been calling for right from the beginning, saying we need more vaccines and we need distributed manufacturing, because the inequities we saw in access were clearly linked to manufacturing capacity that regions and countries had, not just for vaccines, but also for other things like, drugs, monoclonal antibodies, as well as diagnostics and personal protective equipment. So I think the pandemic has put the spotlight on those gaps, and we need to fill those gaps. So what we are doing is we've set up these mechanisms. We've set up the mRNA Technology Transfer Hub in Cape Town, in South Africa, working with companies like Afrigen and the government of South Africa to help to develop mRNA vaccines, which can then be groups from other countries will come and get trained there on the technology that's being developed. The technology is being developed based on publicly available information. As you know, there are two companies, the BioNTech, Pfizer, and Moderna, that have licensed mRNA vaccines. We would be delighted if they were to partner with the WHO and the mRNA Technology Transfer Hub. There are also other companies now making second-generation mRNA vaccines. So I'm very confident that in the next months and years that we will see mRNA technology really getting established in Africa, as well as in parts of Asia and Latin America that need new technologies to tackle COVID and to help end the pandemic, but also then to tackle other diseases like tuberculosis and HIV, for which we really desperately need better vaccines. So I think research on those diseases using these mRNA platforms hopefully will also give us vaccines against other infectious diseases. So this is a medium to longer term plan, and the WHO will work with all interested countries and partners, companies within those lower middle income countries to make this happen.
Dr. Soumya Swaminathan, she is the chief scientist at the World Health Organization. Thank you so much for the information that you have shared with us. Really goes a long way coming from an authoritative organization.